Okay, let's take a little break from the podcast and answer some questions from Instagram. I'm going first.
Okay.
Shannon, is there a health goal for women in their 50s and 60s that they should really aim towards and are most attainable?
Here's what I would say. That is a very transitional time in a woman's life, whether it be the stage in life with perimenopause and menopause. But if you've been a mother, then you're probably an empty nester. So that's a very transitional time. A lot of changes going on just in your lifestyle. But I would say what I would focus on for the very reasons that I just mentioned are knowing your metabolic health. So running some labs through a good doctor who listens and takes time with you. I'm a big fan of integrative medicine, where you are combining medical doctors with more functional and integrative medicine. So I would recommend you find a very good integrative doctor who can help you through that transitional phase. I would recommend you follow a Mediterranean diet. I mean, that's about as best as I can do in a kind of a nutshell. Mm-hmm. Our Get Better Not Older protocol would be a great place because it's taking you through that stage of life and taking you from where you are now and helping you improve. And then we want to obviously preserve what you have. And then, of course, walking 10,000 steps a day and making sure you are also doing some strength training at least 2 to 3 times a week.
What are your biggest pet peeves in the current social media environment with regard to fitness and health?
I just think it's the amount of people who are pretending to be professional, pretending to be experts because they read a book or they did a so-called certification. They have no business just because they have a tight little outfit on and big muscles giving nutrition information or health information. That's my pet peeve. What about you, Dr. Rowe?
Yeah, so you nailed it. That's my pet peeve too, is I started saying this to my friend Lisa about 5-6 years ago. Everybody is an expert on social media, so nobody is. And that is my biggest pet peeve. Just because you look amazing with your shirt off and you can lift a ton of weight.
But you do.
I need to get better, not older. Just because you look great naked or in a sexy little outfit or your ripped abs or whatever, you can squat 600 pounds. Great, awesome for you. I'm happy for you. But it doesn't make you an expert.
Yeah.
When I make recommendations and I say, don't do this move, it's a garbage move, I will have all these trainer bros go, well, I've been doing this, this, and this, and this, and the research shows this, 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 and this, and this. And I don't ever say it because I don't want to engage in these arguments, but have they seen over 10,000 patients like I have and dealt with back pain in a clinical setting for 25 years? They haven't. They've seen a couple of people here and there, and anecdotally, their recommendations help. You're an expert in your field. I'm an expert in my field.
With 50 years of combined experience,
and I'm not
which
saying
makes a difference.
Right. And I'm not saying I'm any smarter than anybody else, but just kind of know your role. How about that?
Stay in your lane.
Stay in your lane.
Okay, my turn to ask.
Controversial. Go.
My turn. All right, Rob, if you could turn back time and be the inventor of one exercise, which one would it be?
Ooh, God, it'd be cool to invent an exercise. Gosh, I wish I would have invented the Russian twist because it's so good for your core. Not.
Oh my God.
No, I'm joking. Don't do Russian twists. Garbage move. Either the squat or the deadlift because they're foundational movements. If you can't squat, can't get off a toilet, can't get off a couch. If you can't deadlift, you can't pick up things off the ground. So I would like to be the inventor of the squat and or the deadlift.
I wish you could be the inventor of that for women so that they're not so intimidated by it because they think that is only for men with muscle shirts on in the gym grunting.
Yeah. So one of the biggest misnomers that I've seen my whole career is women saying, and I just had it with this new woman I've been training. She's 63. She's very fit. And she said, okay, but I don't want to get big and bulky.
Yeah.
I would never do it because I try to be professional, but I almost want to break out laughing because I've been trying to get big and bulky since I was 18 years old and I'm 52 and I've maybe put on 15 pounds of muscle. Now, if I did steroids, it'd probably be a lot more. But women are not going to get big and bulky because you guys don't have the testosterone or the joint morphology to manage big and bulky unless you take ergogenic aids,
But
steroids.
it would be really cool had you been the inventor of this thing that makes it where women do it more than men.
That would be cool.
That'd be so cool.
Let's move on. Shannon, what is your go-to meal for a sweet tooth?
I mean, it doesn't include any sweets. So in other words, if somebody thinks that I'm going to tell them something that's going to encourage or help appease that sweet tooth, I'm talking here about prevention. So if you tend to have a sweet tooth, and I would say in my 30 plus years of counseling patients that typically comes in the evenings after dinner. What I would say, if you tend to have a sweet tooth, pay attention to what you did for breakfast because that makes a difference. Again, in our GBNO 12-week protocol, I go through all of this. So I would pay attention to, how much protein you're eating with all three of your meals. I would try to get a minimum of 30 grams of protein, minimum, no matter what age or, how old you are. And at dinner time, if you tend to have that sweet tooth after dinner, I would make sure a minimum of 30 grams of protein plus a serving of good fat. It's going to help you feel fuller, faster, for longer. If you add to that a bunch of veggies, which are going to be, one, hit your nutritional needs, two, add fiber, which helps you stay fuller, faster, for longer, helps lower your blood sugar, which will help curb that sweet tooth. That is what I would do. That might look like something like an egg salad made with avocado-based olive oil or olive oil-based mayonnaise, because there's your protein and there's your good fat. Or chicken salad made, have you seen now that they're taking, like a rotisserie chicken and chopping it up and then adding avocado to it to kind of make like a chicken salad with avocado, which is really delicious. But that is going to fill you up and it's definitely going to satiate you. And what I mean by that word is it's going to help you not have that craving for sweets. If you still have a sweet tooth, I'm a huge fan of the nut butters that have the cocoa in them, like a Justin's. Just a tablespoon of that takes the edge off the sweet if you still have it.
That's my go-to. Justin's, what's the one? Vanilla almond, yum, and the chocolate hazelnut. It's very low in sugar, pretty high in fat. It's got nice flavor to it. So
you're getting protein, fat, and very low sugar.
Yeah. So if I, again, eat properly, you're going to be okay. Nice big spoonful of that. That'll knock out that sweet tooth.
That's right. And I like dark chocolate as long as you can control how much. A couple squares. Okay. Dr. Jones. Hey, Dr. Rob, what causes the pain in my lower back when I'm bending over?
Ooh, about a million things. Honestly, one of the most common causes of low back pain that I see clinically is lumbar flexion, which means bending over like this. We sit all day long in this slump posture. This is forward, this is backwards. No. So we're rounded. Okay. Now, when you go to stand up, you will come back here a little bit, but you spent a lot of time here. So now your discs are starting to be a little bit migrated this way. You go to bend over a lot, then go to the gym and do sit-ups and crunches. Now you've caused a potential for a disc bulge. That's number one, is as you get older, discogenic pain. It can also be just a little strain in the ligament or muscle. The main thing prevention-wise you can do for that is a hip hinge. So instead of, thank you very much, instead of bending like this, which is flexion, bend like this, which is a hip hinge. You will never hurt your back if you bend with a hip hinge. Now, now hold on, let me finish before you all the gym bros are going to go, well, the spine is supposed to bend this way, man. And if you don't bend it this way, man, you're creating nocibic behavior, man. And you should do sit-ups to train the back to do that. fine. Do that if you want to do that. If you want a healthy spine, your back will round like that incidentally throughout the day. But if you're deliberate about hip hinging, you're not going to hurt your back.
I mean, I think that the important point there is that repetitive, constant this versus hip hinging,
Yeah.
The majority of the time. Then when you do it a little bit, it's not going to hurt you.
No. Yeah, we're designed to flex, yes. If we do it too much and with too much load, that's how we end up having problems.
So when I'm bending over to get things out of the dryer.
Hip hinge.
Right.
Okay, when you're bending over incidentally to spit toothpaste in the sink, you're probably going to be okay. Unless you have a herniation, then you never want to bend until that herniation heals. So that's it on questions, right?
Yeah.
Okay, awesome. Keep them coming. We love to answer them, and as you can see, we got plenty of answers. So back to the podcast.